Today we're going to talk about alcoholism, both male and female, and also touch on everyday drinking, and how all of these things differ. This time I want to focus on people who are considered successful: artists, top athletes, politicians, business owners. Their cases are often more striking and interesting. And of course, with these people we clearly see that lack of willpower isn't the issue. They have willpower. Look at what they've achieved. But something in their personality, puzzle, is still missing. Let's take a closer look at what exactly goes wrong. The cause: biological, psychological, social. First, biology. We're all born with different enzyme systems. We break down alcohol differently. A Chukchi man can get drunk from one bottle of vodka, while a Spaniard can drink wine every day for years without falling apart. Their metabolism works differently. That's also why women become addicted faster. Their body breaks down alcohol much slower. Another biological point: in an alcoholic, the pleasure center reacts so strongly to alcohol that it blocks all other sources of satisfaction. That's why they return to drinking again and again. Psychology, childhood and emotions. Psychological factors form in childhood, usually in dysfunctional families. A child grows up dependent, because adults do everything for them. Such a person cannot tolerate stress, emotional overload, or the need to wait for results. They need relief right now. That's why, later in life, stress: right-pointing arrow drink. Awkwardness: right-pointing arrow drink. Need to socialize: right-pointing arrow drink. They simply can't handle their emotions. They run from them. Social environment. Next, the environment. Alcohol becomes part of the lifestyle. Politicians negotiate in saunas and restaurants. Businessmen drink at meetings. Artists, doctors, same story. When I used to work in a clinic, we even had a crystal rifle, a huge container we filled with vodka, condensed milk, and coffee. Staff drank it constantly. That's how everyday alcoholism looks. And everyday drinking isn't the same as binge drinking. Everyday drinking: a person drinks constantly, maybe all life, but doesn't go on long binges. Still harms the brain, health, life. Alcoholism includes binges, loss of control. Spiritual factor. Alcoholics, like overeaters, often live on the most primitive level of pleasure: food, alcohol, simple entertainment. You rarely see an alcoholic in a museum, at the opera, traveling for spiritual growth. They want simple, immediate pleasure. By the way, alcoholics are often much kinder than drug addicts. When you work with alcoholic groups, there's less aggression. Riding an elevator with an alcoholic is not the same as riding with a heroin addict. It's simply safer. Consequences. The most dangerous consequence is not liver cirrhosis, it's brain atrophy. The alcoholic slowly becomes mentally weak. You can see this clearly in actors, once brilliant, and then, after years of drinking, their speech becomes dull, thinking slows down, they sound childish, simple-minded. This is the most tragic outcome: loss of personality. Treatment. Treatment is also biopsychosocial. Biology: a narcologist handles the medical side. Social part: the person rebuilds their lifestyle. Changes friends. Sometimes changes jobs. Changes daily routine. Sets personal boundaries. Spiritual part: a person must find higher level meaning. For some, religion. For others, yoga, meditation, travel, psychology, Eastern practices. Anything that develops the inner world rather than feeding primitive urges. Psychological factor: my main work. And finally, psychology. This is what I work with the most. Addicted people can't handle emotional overload. Let's look deeper. Here we use the concept of persona and shadow. Alcoholics, especially successful ones, often avoid conflict and wear strong masks. They show the world: I'm fine. I'm successful. I'm positive. I'm strong. Politicians lie constantly. Businessmen pretend. Housewives pretend everything is perfect. They suppress anger, envy, sadness, everything. But suppressing emotions requires enormous energy. They come home, exhausted from pretending, and drink to release the tension. Their shadow, the real self, is locked inside. And the more they hide it, the worse the addiction becomes. When they finally allow themselves to be real, express needs, show emotions, speak honestly, the craving for alcohol drops. Because they're no longer wasting energy hiding their true self. All their strongest resources are hidden in that shadow. If they integrate it, they become 10 times more effective, stronger, fuller as a person. But they're terrified of rejection and conflict, so they keep smiling, and then drink at home. In therapy, we learn how they can be themselves, express feelings, voice needs, stop pretending. This is where real recovery begins. That's all for today. See you soon.